Thank you, Madam Speaker. Before I was elected in 2014, I was approached by a really good family friend in Denison who made an emotional appeal to me to support the expanded use of medical marijuana of cannabis oil. One of her very good friends is a leader in this effort because her daughter suffers from intractable epilepsy and seems to benefit greatly from the use of the oil. This is a very emotional issue for all of us. It is gut-wrenching to see children suffering. But feelings are not facts, and feelings are not logical or fact-based. Representative Nunn, I deeply respect the work you've done on this bill. I deeply respect your perspective on this, but I do not believe this to be in the best interest of Iowa as a whole or the safety of its citizens. We are being asked to abandon previous precedent, abandon normal medical protocols, reject the recommendations of much of the medical profession, the Food and Drug Administration, and the Iowa Medical Society, and expand the use of a marijuana derivative, cannabis oil, in Iowa. We are being asked to do this based on testimonials and not the traditional evidence-based process used for all other medications. This is not how we legalize medicines. This is not how we ensure the safety of medications for society as a whole. Let's put this into perspective. We don't do this for any other drugs. A December 2015 World Health Organization report on medical cannabis states, and I quote, "Globally, the efficacy, safety, and quality of the medical products on the market in countries have benefited enormously from a robust scientific and evidence-based process. By following a rigorous process, the scientific, medical, and public community can be confident that decisions are made on the basis of scientific data and judgment. This is the hallmark of an effective system for protecting the public. If cannabis is subjected to the same criteria as all other medications, the medicine's approval process would require that clinical trials be designed and conducted in a way that provides regulatory agencies with the necessary scientific data upon which they can make approval decisions. Without official approval, there would be no requirements for post-marketing surveillance and reporting of adverse events," unquote. It is quite clear that medical marijuana and its derivatives have not completed this traditional, rigorous, scientific, evidence-based process, because if it had been, we would not be sitting here this evening trying to set up a system outside the traditional medical protocols. But that rigorous, evidence-based process is in work and should be completed soon. The FDA is currently conducting this evidence-based testing on Epidiolex and other marijuana derivatives, and according to a January 2016 report from our Governor's Office of Drug Control Policy, it states, quote, "Final clinical trial results are expected by the summer of 2016, and if positive would result in an immediate application for FDA approval and subsequent rescheduling of this specific CBD product. If all goes well, Epidiolex could be on the U.S. market as a prescription drug in 2017, unquote. Since this is the case, why, ladies and gentlemen, this evening are we trying to jump the gun, abandon normal medical protocols, and create a scheme that would put Iowans at risk, potentially? Why are we treating marijuana derivatives differently than we do all other drugs being considered for medical purposes? The Governor's Drug Control Policy Report concludes, quote, "Recent advancements in expanding and fast-tracking the study of promising cannabis derivatives for possible therapeutic use is encouraging. Rigorous research must continue to help those in need with timely, tested, safe, and effective medicines without giving false hope or compromising the health and public safety of Iowans," unquote. Clearly, many experts, including, I believe, Dr. Yossi here in Iowa, feel it is important to allow this evidence-based process to continue, which is now on a fast track by the FDA to conclude. Medical reports suggest some children are helped, others show no reaction, and still others have adverse reactions to the use of cannabis oil, and as of yet, we don't know why. Dr. Kevin Chapman, a neurologist at Children's Hospital Colorado outside Denver, stated, quote, "We don't have enough data at this point to recommend marijuana products for families," unquote. Dr. Chapman is co-author of a study released at an American Epilepsy Society meeting in December of 2015. We in this chamber, I would submit, ladies and gentlemen, do not have the expertise to step outside medical protocols and pass this amendment. What are we basing the conditions we are adding for the use of cannabis oil in Iowa? Is it an arbitrary process? We know that the evidence-based process of scientific research has not been completed for the conditions we propose to add with this amendment. We should not approve something based on testimonials that could actually hurt some of our children and our citizens. As Dr. Chapman stated, some children have adverse reactions to this oil. To those who support this expansion, I would simply ask, how do you justify such risk to the citizens and children of Iowa without the conclusion of the normal medical processes of scientific research and blind studies? What do you believe gives us the expertise to make this decision against the advice of a lot of medical experts? Please contemplate what could happen if we support this expansion and abandon the evidence-based process that soon could be concluded. Recent reports show a buildup of THC in the body. It builds up over a long period of time, so even at 3% or below, as our law currently requires on the THC level in oil, could there be additional health risks? Are there addiction risks? Could this oil and THC level lead to addiction and adverse health consequences for our citizens who depend on us to promote the general welfare? Here are some facts on the medical use of marijuana that have been reported. Scientists report brain abnormalities from medical or recreational use by young people all the way into their 20s. Various phases of learning and memory can be affected, as well as signs of depersonalization, distorted sensory perception, and altered time perception. Attention, concentration, decision-making, impulsivity, self-control, reaction time, risk-taking, verbal fluency, and working memory are impaired acutely in a dose-dependent manner. Could this marijuana derivative, this cannabis oil with this 3% or below level of THC, be contributing to some of these things over time as it builds up in the body? Long-term effects that have been reported. A significant number of individuals report paranoia, persecutory ideas, hallucinations, altered brain structure and brain circuits, impaired short-term memory, compromised judgment, decision-making. The list goes on and on. Could this oil and THC level lead to addiction and adverse health consequences for our citizens who depend on us to promote the general welfare? A few quick facts about medical marijuana's effect on our society. The National Institute on Drug Abuse reports marijuana is addictive, with nearly 4.5 million Americans meeting the criteria for marijuana abuse or dependence. Could that THC level we're talking about create dependency and addiction? Possibly, but we don't know because we haven't let the evidence-based process conclude. 74% of Denver teens in substance abuse treatment say they used somebody else's medical marijuana. Adolescent use of marijuana is substantially higher in medical marijuana states. Currently, Iowa is 49th in the nation for marijuana use. Only one state has lower use than Iowa. This is not a statistic I wish to change. The top 21 states for marijuana use among teens all have approved medical marijuana in some form. The top 21 states for marijuana use among teens all have approved medical marijuana in some form. Only one state currently has lower marijuana use among teens, and that is Alabama. And they don't have medical or recreational marijuana to my knowledge.